You know, I have such great access to medical. It's good to be president, I guess.
It seems like Donald Trump made a really good case for universal health care the other day.
It's a lot easier for me than somebody that's, doesn't have access to a doctor so easily, where it's a big deal to see a doctor.
You sure did, Ali.
The doctors at Walter Reed were incredible.
Last weekend at Walter Reed Medical Center, President Trump received the highest degree of health care in the world, and it was on the taxpayer's dime.
This is an incredible hospital, Walter Reed.
According to the New York Times, the treatment that the president received would have cost the average American at least $100,000 in medical expenses. That estimate is on the low side.
I'll be the doctor here, and I promise you no copay.
Okay. Sounds good to me, Mark.
Senator, good to see you. You tweeted, Mr. Trump, guess what? The Walter Reed Hospital you were at, where you claimed you got excellent, high-quality care, that is a 100% government-funded, government-run, dare I say, socialist facility.
What they're doing is socialized medicine, and it's not acceptable.
You and I know, Senator Sanders, where I come from in Canada, everybody gets the same health care and everybody pays the same for it. That's not the case in America.
They want to go socialized medicine. Socialized medicine.
What Trump's illness and treatment tell us is that healthcare is a human right. It's not a job benefit. Everybody, rich, poor, young, old, is entitled to healthcare. Your Medicare for all single-payer program. And that idea is gaining more and more momentum every day, especially because of this pandemic.
I feel so good. We have these great doctors at Walter Reed.
Let me just say this for the umpteenth time. What I am talking about, what Ali is talking about, is not radical. It exists all over the bloody world. What we are doing is radical. What we are saying is you don't have health insurance because you have a bad job. That is crazy stuff.
The work they do is just absolutely amazing. The equipment was incredible. I've never seen equipment like this before.
For ordinary people, it's not only that they're uninsured or underinsured. They go to the doctor and they find out they thought they were covered. They're not covered. They have to pay out of pocket. 500,000 people go bankrupt because of medically related bills. People go crazy filling out forms. Doctors are sick and tired of having to pay attention to the insurance companies rather than their patients. This system is dysfunctional, it is cruel, it is wasteful. We have got to join the rest of the world, move toward a Medicare for all type program.
Walter Reed, what a group of people. They've done a fantastic job.
The kind of care that Trump got is good. That is the kind of care that every American should get.
Walter Reed Medical Center. I think it's the finest in the world.
I don't begrudge the President of the United States getting the health care that he needs when he is seriously ill. But I do very much resent the fact that we are the only major country on earth not to guarantee health care to all people as a human right.
I just left Walter Reed Medical Center, and it's really something very special. The doctors, the nurses, the first responders.
That is why I am a strong advocate for a Medicare for all single-payer system, which means you go into any doctor's office, you go into any hospital, you do not take out your wallet, you do not take out your credit card. It is 100% publicly funded, available to all, whether you're rich or whether you're poor. But I think, Stephanie, this whole COVID-19 crisis, above and beyond Trump's illness, tells us how dysfunctional the current system is. Millions and millions of people have lost their health care because they have lost their job. And what I think the American people understand is that health care is a human right, not a job benefit, not a privilege. All of us, rich, poor, old, young, are entitled to health care, whether we're working or whether we are not. And the momentum for a Medicare for all single-payer system is growing stronger every single day. We should not be paying twice as much per capita as our neighbors in Canada, while 90 million Americans are uninsured or underinsured, and we pay by far the highest prices in the world for prescription drugs. The American people know that.